This past year has been the most turbulent year of my entire life. My grandpa's been in and out of the hospital, and my mom almost died. For months, she'd been complaining of an unbearable pain, and she refused to go to the hospital doctor because she couldn't pay for it. I alone make more money than both my parents combined, and that's not much. So finally, she went to a free clinic down the road, and the doctors there told her that she had to go to the hospital. It was serious. But despite what they told her, and despite the fact that her pain was getting increasingly worse, she was still very hesitant to go. Finally, her friend Joelle stepped in and convinced her to go to the hospital. And beyond grateful for Joelle doing so, because had she not, my mom wouldn't be around today. Thankfully, she's on the path to recovery now. But for many Americans who go through the same kind of ordeal, their outcome isn't so good. And the cause of all this pain? Our healthcare system. There's so much corruption and confusion within and about our system that the least everyone should be doing is researching and getting informed and supporting the reform that's about to take place. We're America, the richest and most advanced of all the nations. Yet, of almost all developed nations, we're one of the only few that sees healthcare as a privilege instead of something that's necessary for every citizen. Over 40 million people in America are without health insurance coverage, myself included. Even when healthcare is supposedly free, it comes at a cost. Dr. Robert Lebeau, a physician and author of Healthcare Meltdown, tells of an experience that he had while working at a freak health clinic. One day, a mother and her 17-year-old son came in to see him. Her son had a cough that had not gone away or gotten any better over the course of 2 weeks. He checked him out and diagnosed him with asthma. And while he was writing the prescription for an inhaler, the normally reserved boy started crying. Dr. Lebeau asked him what's wrong, and the boy looked at him and goes, "On our way here, my mom told me that we didn't have enough money to even pay for the visit, let alone any medication that would come out of it." And Dr. Lebeau assured them, "It's a free clinic. Your costs will be covered. You don't have to pay for anything." But sure enough, as soon as they walked out the door, the clinic's collections person approached them and asked for their nominal $8 fee. So instead of leaving the clinic with medication, they just left with tears. Each year, the entire world spends $4.7 trillion on health insurance. And according to the World Health Organization, $2 trillion of that comes from the United States alone. And it's amazing how the country that's spending almost half of the world's healthcare expenditures still sends people home without any healthcare or coverage or medications, oftentimes leading people to their permanent home 6 feet under the ground. Besides not being able to afford insurance or just being too confused about the system, many people who need health coverage are often denied it. And what makes it worse is the reasons they're denied. Their health conditions. Most insurance companies won't provide adequate, if any, coverage for people with pre-existing medical conditions, such as cancer. And those who do have coverage get turned away when they need their healthcare system the most. One lady, who actually worked for a health insurance company, experienced this type of corruption firsthand. Her husband needed a surgery. It was imperative to his life, and the only way they could pay for it was through their insurance company. And each time she sent a request to get the money, the insurance company denied her, saying that his surgery was experimental and unnecessary. A few months later, with absolutely no headway, he died a day before his birthday. When what's really sad is just a change of residency could have saved this man's life and given that 17-year-old boy an inhaler. In Canada and France, no one's denied health coverage. When a couple in France was asked about what their most expensive monthly payments were, they said their fish, their pet fish. They didn't have medical bills. They don't pay monthly costs or any costs for health insurance. And they laughed when they thought about having to pay for something that should be universally provided. And just because everyone is allowed medical coverage there doesn't mean that their coverage is any less great than it is here. When I went to France a couple years ago for a school trip, My friend Katie got really sick while we were visiting in Frears, and the ambulance rushed her to the hospital. Only 2.5 hours later, she was back at the hotel with us, and she was feeling much better. She didn't have to pay anything there. I kept wondering what her bill was going to be when she got home because I just couldn't comprehend not paying for medical care. Many countries not only don't charge for their medical care and their hospital visits, but they charge much less for the prescription drugs and sometimes don't charge anything. Pills here in the US cost anywhere from $4 to hundreds of dollars for one prescription. According to research done by the United States House of Representatives, our government, pills in France, the same exact ones you get here, are 45% cheaper than they are here. One popular stab at other countries' systems is the fact that, non-emergency operations take longer to get done than they do here. And you know what? It's true. But you need to look at it in a reasonable, intelligent way. You can have one system like theirs, where a few people wait a while for a non-emergency surgery, but they eventually get it. And the rest of the country is covered, and they always get their medical care that they need. Or you can look at ours, where several people who can afford it right away get their surgery right away. And then the people who can't afford it never get the surgery. And most of the country goes without coverage. It seems to me to be a question of selfishness and profits. President Obama has proposed a bill for healthcare reform. It just passed in the Senate, and he's hopeful that the rest of Congress will follow suit. According to the White House's website, here's the president's plan in plain English. For those who already have insurance, the plan will end discrimination of those with pre-existing conditions. It'll stop insurance companies from dropping those who develop illnesses or diseases. It'll put a cap on how much people spend out of pocket. And it'll cover the gap for prescription drugs. For those who don't have insurance coverage, the plan will allow people to buy coverage at cheaper rates by making a more competitive market. It would provide tax credits to small businesses who provide their employees with coverage, and it would also offer public health coverage to those who don't have coverage. With the new president in office ready to make changes, he needs the back of all of us as citizens. It's time to start paying attention and getting informed. It'll be a long, hard road to get to the best system we can, but it all starts with the first step.